While California is looking to speed up the COVID-19 vaccination process, county healthcare officials say the state could be sacrificing equality.
Yeah, they're concerned that people in underserved communities aren't getting vaccinated. KCRA3's Brittany Johnson has been looking into this for us. She joins us live now. So, Brittany, is there a clear gap here?
Well, yes, there is, Brian. There is a clear gap. We just don't know how big it is. That's because the state of California is not releasing that information. Now, we're trying to get it. These are copies of multiple requests that I have put in with the state to get that information. Health officials fear that without it, those hit hardest by the COVID-19 pandemic will be left behind.
County health officials are calling out the state for focusing too much on the speed of COVID-19 vaccine distribution and overlooking where distribution falls short. Dr. Amy Sisson, Yolo County Health Department, addressed this during a legislative hearing yesterday.
Its emphasis on speed has the potential to benefit the privileged more than the underserved.
One of California's areas hardest hit by COVID-19, Los Angeles County. Dr. Paul Simon is with the LA Public Health Department. He says health officials are aware people in underserved communities are not getting vaccinated at the same rate as those in affluent white communities, but adds officials are struggling to understand how large the gap is, pointing to state data that is incomplete, inaccurate, or doesn't exist at all.
These early results are extremely alarming and indicate that we need to make it much easier for Black and Latino residents and workers to be vaccinated.
As COVID-19 has spread through the Black, Brown, and Native American communities, the Centers for Disease Control says tracking the number of people vaccinated in those communities is critical. For weeks, KCRA3 Investigates has asked for this information from the state health department. We put in public information requests dating back to January 21st and sent follow-up emails, only to be told this month it shouldn't be much longer, and progress is definitely being made. And we're not the only ones who want this information.
There's a great interest in understanding what the landscape looks like here, and we are struggling with the data.
While California hasn't released this information, other states have. According to the CDC, during the first month of the U.S. COVID-19 vaccination program, nearly 13 million people got at least one dose of a vaccine. 60% of them went to white people, 11% Hispanic, 6% Asian, 5% Black, 2% Native American. The CDC couldn't tell us where the other 15% went. So why aren't more Black, Brown, and Native American people getting vaccinated? Dr. Anthony Harris, who works in public health, says access is part of the problem.
Many of those in these communities don't have adequate transportation to even get to a location to access the vaccine if it's not within walking distance.
Dr. Harris says trust could be another factor. He recommends the state reach out to trusted members of various communities.
Leveraging churches that we know exist in many of these communities, and they have some infrastructure to leverage and distribute the vaccine. And I've seen it work well in Central Florida with that partnership between hospitals and churches.
And then there's the whole issue of immigration status.
But we're also seeing where undocumented communities may be nervous about making an appointment in advance. And so what we've done in Yolo County is setting aside doses for people who don't have an appointment so that they can walk in and they don't have to give information to the government in advance.